The biggest reason we've seen the rise of telemedicine in the last few years is the real crisis that's going on in our primary care system here in Canada. There are many amazing things that our Canadian public health care system can do, but we rank dead last in the developed world when it comes to timely access to primary care.
You're listening to the Small Business Mastermind, a podcast created by Olympia Benefits to help small businesses juggle business, finance, health, and wellness. I'm your host, Morgan Berna. Have you heard the term telemedicine? Also known as virtual healthcare, it's the delivery of health and health-related services by digital technology, meaning it's a way to talk to doctors and nurses directly from your computer or cell phone. Explained by some as being the answer to the current strains on the medical system, telemedicine opens on-demand medical care up to anyone with internet access. On this episode, I chat with Steve Chamberlain from Dialogue all about telemedicine. We go over what exactly it is and what it can be used for, how it works for people with primary care physicians, privacy and data security, as well as how it fits into the business model of a small business. I ask him about common concerns people have with telemedicine and tips for successful implementation. So without further ado, let's jump right into this conversation. So hi, we've got Steve today. Thank you so much for being here, Steve.
Yeah, thanks for inviting me.
Steve Chamberlain leads Western Canadian business development for Dialogue, the leading Canadian platform for virtual healthcare for employers. His career began in the tech world, leading a digital media startup to 25 times revenue growth, and he joined Dialogue after 4 years with Monster Canada as Director of Enterprise Solutions. Steve is intimately involved in the Calgary community as a member of Young Professionals in Energy and president of the AAISP Calgary chapter, and he was a guest speaker at both the 2016 and 2017 Global Petroleum shows. So today we're talking about telemedicine, and before we kind of jump into all the questions I've got, can you just let us know what telemedicine is?
Yeah, so it's a broad term. I mean, simply put, it's the ability to connect with healthcare virtually, be it a physician or a psychologist. I mean, the telemedicine, has kind of been in the public idea for about 100 years. It first came to province about 1925. There was a guy by the name of Hugo Gernsback who wrote in the Science and Innovation magazine about this device called a pterodactyl that he envisioned in the future of medicine, where it was essentially a way for doctors to see their patients through a view screen, but they'd also be able to touch them with like this device with spindly robot arms.
I think I've seen something about this.
Yeah. It's so. I mean, I'll check with our R&D department, but I think telemedicine has kind of moved away from that. But telemedicine has really grown in prominence here in Canada in the last 3 to 5 years.
Mm-hmm. And it's different than telehealth, right?
The terms, there's a lot of terms, whether it be virtual healthcare, telemedicine, telehealth, they really all broadly relate to the same topic.
Okay. How does it work?
Each platform works differently, but with our platform, a patient can log on to either an app or via desktop, and they're able to go through a brief triage process, and then they're connected with a practitioner, be it a physician or a nurse practitioner or a care coordinator. They're able to consult for a medical issue, and they're able to be directed, navigated through the physical healthcare system as well.
Mm-hmm. Yeah, I've been trying it out just to make sure that I understood how it all works. So for listeners out there, I just downloaded an app on my phone, logged in, and then you start a chat. Yeah, and there's kind of initially you talk to an AI system where it kind of just asks you, is this a new problem?
Yeah, just some background questions about what are you here for, how bad's the pain, how long has it been affecting you, and then it'll get into some more specific questions, based on your answers. So if it's for something with your, if it's an eye issue, it'll ask, is it watery, is it runny, is it itchy? Mm-hmm. And really the idea behind the triage process is it's a way to kind of more standard, more effectively triage patients in a standard and safe way, but really not to cut a human practitioner out of the loop. It's really to enable them to have all the information they need when they do get on that call for a more effective consultation.
Yeah, I think I was connected with a real person within maybe like 5 little messages, quick questions. It
Yeah.
really wasn't too much at all.
Yeah.
Yeah, and then you get connected with someone, you start chatting, and then you can either chat through like texting on the app or on your desktop, or you can actually do a call or a video.
That's right. Yeah, via chat, via phone, or via video. So for some consultations, I mean, the scope of practice for the physician is obviously the biggest when they can physically see the patient. They can make that medical assessment, and then they're able to make an assessment. They're able to prescribe if necessary. They're able to give specialists referrals. Really, the full scope of practice of telemedicine is about up to 70% of all frontline care that can actually be managed virtually.
Oh yeah, I think we all know those times we've gone to the doctor and we know we just need an x-ray form or something, and this is a pretty quick way to do it. So I know for me, I chatted with someone, we did a video call, that was really nice. I actually found I talked longer with the person I was chatting with than I would with my primary care doctor.
Yeah, it's funny you mentioned that because 80% of Canadians said the last time they went to see a family doctor, that visit was less than 20 minutes.
Oh yeah.
And for 40%, it was less than 10. I mean, if you're going to an urgent care facility, typically, your consultation is limited to 15 minutes. It's limited to one issue. We don't really have those limitations on our platform.
Mm-hmm. Yeah. So I chatted with someone, and then afterwards I was given a follow-up plan.
Yeah.
Which was nice. And then it's kind of nice too to have it in writing there on the app. So if you forget, I know some people get anxiety going to the doctors, or you might just kind of blank on what they told you.
Yeah, even just having a record of your chat.
Yes.
Every patient gets a care plan afterwards, which details a summary of the call and what to expect in terms of follow-ups and how to apply any medication, and just being able to go back and review that can be quite helpful, because I think we've all had that experience of walking out of the doctor's office and then trying to remember exactly what they said.
Oh yeah, I didn't pay attention at all.
Yeah.
I was just focused on trying to remember what to tell the doctor. I usually go in with a big list or
yeah,
something.
And further to that, I think part of the advantage of the triage process that we've set up is that when you go to a walk-in clinic, typically in that 15-minute consult, probably the first 8 to 10 minutes is that doctor or nurse triaging you.
That's true, yeah.
Then typically you'll get 2 to 5 minutes for a consult. You got 2 minutes for questions, and then you're out the door.
Mm-hmm.
So by having that triage process, spending 2 to 3 minutes up front answering a couple of background questions, it really enables more effective consultations with the practitioner.
Mm-hmm. Yeah, and then if you need to go back, if you need to chat further, you can also go back to that original chat and just add in more messages, correct?
Exactly, yeah.
So if you kind of need a follow-up. And then it's nice, too, if you're at work, because you can, send a chat and then just wait for a reply like you would a text for something.
Yeah, exactly. You're not in a waiting room. You can put your phone down. You'll get a notification when a practitioner responds to you. So it's a really convenient way to access healthcare on your own time.
Yeah. One thing that I wasn't sure of is when you do the triage process, you're not always immediately connected with a nurse or a doctor, right? There can sometimes be you set up an appointment for another day.
Yeah, typically most patients like to consult on a time that's convenient for them.
Mm-hmm.
So if you want to be seen right away, typically our patients are being seen within minutes.
Okay.
But a ton of patients would rather set up an appointment, whether it's on their lunch break or after work or when at home, after the kids have already gone to bed.
Mm-hmm.
So it really does vary.
Yeah. We're talking about how you go on a video call and stuff and chat with someone. Who are we actually chatting with when we're on that call?
You're talking to Canadian physicians, nurse practitioners, nurse clinicians, and care coordinators. So that Dialogue is licensed in all 10 provinces and 3 territories. So each province has its own licensing requirements. So if you're in Alberta, you're speaking to a physician who's licensed to practice in Alberta.
Okay. And then is who you end up talking to sort of based on that triage process? The severity of what you're talking about as well?
Exactly. So the triage process, because we have a multidisciplinary team of all those different kinds of practitioners, the triage process is also going to be able to determine what's the best resource for you. Maybe it is a physician, or maybe it is a nurse practitioner, because nurse practitioners have more experience in particular in particular illnesses. And if it's something that falls outside of the scope of practice of virtual care, then you would be directed to a care coordinator who would help you navigate the physical healthcare system. So just because you're not being able to be treated on the platform, it doesn't mean we can't help you find a local health resource.
So sending you information about like a clinic you could go to, or?
Yeah, exactly. It might be a walk-in clinic with, from my own personal experience. I mean, when I logged on, it was for an elbow infection. It needed something. It needed a physical consultation, and the care coordinator provided me with 5 walk-in clinics closest to my house with the estimated wait time of each. And she actually went above and beyond and called ahead to the one that was closest to my house to verify that their information was correct and that I could get in to be seen within a few minutes.
Nice. And can you be prescribed, or I guess maybe prescribed is not the right word, but can you be referred to things like an X-ray or like labs?
Yep, lab work, blood
Yeah.
tests, absolutely.
Okay, awesome. This to me is very exciting because I grew up in British Columbia, and in British Columbia, it is so hard to get a doctor. I had such a difficult time. I don't think I had a family doctor since I was a little kid. So to me, this was quite an interesting thing to hear about, to have that option, because I would often spend my lunch break going to a walk-in clinic if I ever needed to, or having to go to the hospital for something. I think you had mentioned a stat once to me about how many Canadians don't have, or the lack of physicians in Canada.
Yeah, so that really relates to why telemedicine has become so prominent in the last 3 to 5 years. I mean, the first reason relates to mobile technology. I mean, 86% of Canadians have smartphones now. Most others have a desktop with a camera function. So people have access to the technology to be able to access healthcare. The second is kind of the expectations around mobile technology. I mean, healthcare is kind of an outlier when it comes to the things we get from our mobile experiences, whether they be shopping or transportation or banking or communication. Healthcare really has not entered that space for many Canadians. The biggest reason we've seen the rise of telemedicine in the last few years is the real crisis that's going on in our primary care system here in Canada. There are many amazing things that our Canadian public health care system can do, but we rank dead last in the developed world when it comes to timely access to primary care. So the stat you're referring to, 57% of Canadians can't get a same or a next day appointment with their family physician. And if you can't get in to see your family doctor and you're sick or one of your kids are sick, you've got a couple of options, right? Your first option is to ignore the problem.
Yeah.
And hope it goes away, which you're probably less likely to do if it's for a sick child. The second is to Google your symptoms, which is typically a surefire way of freaking yourself out because Dr. Google always seems to come up with the worst case scenario for anything. But the third option is going to a walk-in clinic or the emergency room. And a full 40% of Canadians said the last time they went to an emergency room, it was actually to treat something that their family doctor could have treated if they were available. Yep. So we've put this enormous burden on the urgent care system in Canada that it's just frankly not equipped to handle. So I'm sure you and a lot of the folks listening have their own personal horror stories about sitting in a waiting room for hours. It's kind of that uniquely Canadian experience.
Yeah.
But the net effect of that is just we almost limit our healthcare by the amount of healthcare the system can provide, which is backwards, right? We should be providing towards a system that caters to the needs of patients first and ultimately encourage us all to be proactive about our health. And that really, I think, is where telemedicine can make the biggest difference.
Mm-hmm. Well, I know so many people where, and myself included, I would go to a walk-in, get some sort of test done for whatever my issue at the time was, and then if that came back negative, you just never hear back again.
Yep.
And then your choice is to either go wait again or to just be like, all right, I guess I'm just going to deal with this now.
Right.
And then on the other spectrum, if you are lucky to have a family physician, I know very few people who get like a follow-up. Again, same thing, if you get a test back that's negative, it doesn't necessarily mean the issue's gone. And so I found with this, trying out Dialogue here, I got like a message a couple days later, just being like, how are you doing? And I was like, oh, actually, like, this is still
Yeah.
bothering me. Like,
Yeah.
I just decided that was my life now.
Yeah, that's a really great point, and I think we may all have all had the experience as well of being called back to a doctor's appointment just to be told everything's fine. I mean, I had a circumstance where, I had my yearly physical, and my family doctor's half an hour away from my house. I had
Yeah.
to set up an appointment 2 days later. He called me. They couldn't discuss results on the phone. I had to go back in.
Yes.
So it spent 2 days just waiting. There was something on my physical that was a red flag.
Yeah.
I went back in, and my cholesterol was like 1 point higher than it should have been. So
I've had that exact same experience because I live here in Calgary too, and I got a doctor when I moved here, but it is like a half hour away.
Right.
And I had an x-ray once, and I got called back, so there I am all worried that I have a broken bone. And yeah, it was just to say that it was fine.
Yeah, it's an inefficient way of delivering healthcare, and the reality is there is a better way of delivering it today.
So let's talk about the types of things telemedicine can be used for. I know it can be used for physical health. Maybe you can give us some kind of tips there, ideas there, but then it can also, I think, be used for mental health as well.
That's right. So the scope of practice with virtual care is very broad, whether it's ear, nose, and throat, flu, sexual health, dermatology, healthcare navigation. Mental health is actually a really interesting one because we didn't design Dialogue as a mental health platform, but what we found is that up to 40%, depending on the day, up to 40% of our practitioners' time is dedicated to mental health issues.
Oh, really?
Yeah, and there's a couple of reasons for that. I mean, the first is just that mental health issues just naturally take more time than physical healthcare issues. That's why that continuity of care, when you're speaking to someone, you're getting those proactive follow-ups, is so important. But it also, the broader point is that telemedicine and Dialogue really enable people to have such a safe and convenient and anonymous way of accessing mental health support. I mean, especially for employees who have not sought out mental health treatment in the past, it can be a daunting experience to, especially if you're booking time off work, to go see a psychologist or book a psychologist appointment and wait 4 to 6 months to see one.
Yeah.
Whereas with Dialogue, you could just log on, you can chat with a practitioner, even if it's something as simple as, hey, I haven't been feeling like myself the last few days, or I've been having trouble getting out of bed. It has been such an invaluable resource for so many of our patients.
What type of care is available for mental health there? Is it kind of to orient someone or to help someone get to an in-person psychologist, or can there be is therapy done through the app or anything like that?
Yeah, so some of our practitioners do have training in CBT psychotherapy.
Okay.
On the platform, we also do have available what we call allied health professionals, which includes psychologists, so the ability to connect with psychologists on the platform. But really, it is just about reducing the barriers of access to care and lowering the stigma to be able to reach out to someone and chat with someone about a mental health issue instead of feeling like you have to deal with the problem by yourself.
So it sounds like just in general, it can help you just be more proactive about different areas of your health.
Yeah, exactly.
And I know it's commonly used by companies implement telemedicine for their employees. So helping all the employees be more proactive about their health. Would that be one of the main benefits?
Yeah, for an employer, there's a ton of different benefits. It broadly fits into a wellness strategy. So encouraging employees to be fit and well in their lives, which for an employer has the net effect of having an employee be more productive at work. Now, we get a ton of feedback from our clients because we are solely a business-to-business company, so we only work with employers. And the kind of feedback includes, reductions in absenteeism, so folks don't have to leave work or miss half a day of work to go to a medical appointment. Presenteeism, so the ability to, actually get treatment when you need it and not be preoccupied at work if you've got an illness. And
Presenteeism's when you still show up even though you're sick, right?
Exactly. Yeah. Maybe you're not as productive because you're struggling with an illness at work that's being untreated, or you're just preoccupied, whether it may be a mental health condition that's undiagnosed and it's affecting your day-to-day at work. You mentioned your own experiences moving to a new place and
Oh, yeah.
finding a family doctor. That's
Yep.
something a lot of employers, if they have an employee they've brought in from somewhere else, it's likely that employee is struggling to find a family doctor of their own. For employers that go through high stress, have a lot of high stress situations in their workforce, or especially employers who have a remote workforce.
Oh, yeah. That's a good point.
So either remote employees or their company is physically located in a more remote area outside of a major city center where healthcare resources are already stretched.
And you also can't really check in on your employee, too.
Exactly.
Is this intended to be a supplement or a replacement for family doctors?
It's a supplement.
Yeah.
Yeah, it's absolutely not intended to be a replacement for a family doctor, and it's not intended to keep employees chained to their desk either. If you're sick and you need a physical examination, absolutely you should visit your family doctor or urgent care. But it's really the focus is being able to respond more effectively to primary care and be more proactive about your health. When we're sick now, we as Canadians we kind of make this time health judgment.
Oh, absolutely.
We're sick, but we recognize that if I go in and get physical treatment now, that's probably going to be 2-3 hours out of my day. So maybe I'll just wait till tomorrow, hope things improve, and then I'll make that judgment again.
Yeah.
So this allows us to take that judgment out of it, where we have 24/7 access to practitioners. We don't have to leave our homes. We can do it right from the comfort of our homes using our smartphone, their desktops. Really, there are no stupid questions when it comes to accessing telemedicine. If you've got a concern on your mind about your health, you have the ability to consult with our practitioner. There's no judgment involved.
I think that's an interesting point about the time barrier there, because for our neighbors down in America,
Yeah.
they have to think about the money. Like, can I afford to go do this?
Exactly.
But here we have to think, do I have the time to go do this? And for a lot of people, that is money too, like having to take the afternoon off work or having to leave.
Exactly. It's a more explicit cost health calculation that the folks in the United States have to make. But up in Canada, because primary health care access is free,
Yeah.
It's a time health judgment.
Yeah, absolutely. Are there areas of Canada where it's more heavily used that you guys see?
It really depends, because each province has its own unique challenges.
Yeah.
So, Victoria and Vancouver, for example, it's very tough to find new family doctors. Victoria used to have, for example, they used to have this find a new family doctor service that was available on a website.
Oh, yeah.
And they actually took that down because A, there were no family doctors available,
Wow.
and B, the ones who were on the website just weren't being updated. So it is really tough in Quebec as well, where it's incredibly tough to find a family doctor. So there are a lot more people who rely on urgent care and walk-in clinics. In the prairie provinces, Alberta, Saskatchewan, Manitoba, the access issue is still there. But especially in a place like Saskatchewan, it's much more pronounced in rural areas, where there's a big rural doctor shortage. Now, they've made a lot of improvements in that area over the last couple of years, but it still is a challenge. In Manitoba, mental health funding relative to the Canadian national average on mental health spending is quite significantly lower. So Manitoba is experiencing this unique mental health crisis.
Okay.
Not to say that the Canadian system as a whole is adequately funded from a mental health perspective. So it really does depend on your different provinces where you live. Each province has its own unique challenges.
Who can use telemedicine? Like, who is it best for?
So we see, from our demographic info of folks who are using our service, we see a really wide range when it comes to demographics, both male and female, geographically, age. One area where we do see a higher uptake is folks with young families.
Yeah, I was going to ask parents.
Yeah, parents with young families, with sick children, you're not going to take risks with your child's health. So that, again, that time health judgment, when it's your time versus your child's health, you're going to prioritize your
Completely
child's
different.
health. And, folks with young families are 3 times as likely to visit the emergency room in general here in Canada. So that's where we see a big uptick.
How does telemedicine benefit small businesses?
Yeah, so it's really interesting. So as a company, we do only work with employers. So we have experience working with a really wide range of both industries and company sizes. So
Yeah.
myself personally, I work with companies as small as 2 to 3, all the way up to 20 to 25,000. And I think there's 3 primary reasons it works really well for small businesses. First is kind of the broader wellness strategy. So on one of your previous podcasts, Dr. Terry, he had mentioned that, to really get the benefits, and apologies to Dr. Terry if I'm oversimplifying, but really to get the benefits, you really need more of a comprehensive wellness program.
Yes.
Not, picking out 1 or 2 individual models and hoping it makes a bigger difference on the broader subset. But the reality for a lot of small businesses is, ideally we could offer everything to everyone, but there are limited resources. So companies do have to make tough choices about what's most effective for my business. And the appeal that we've heard about telemedicine is it really does, apply to everyone. There's an interesting stat that 71% of Canadian employees said they would actually trade off current benefits for improved access to practitioners.
Oh, wow.
And the reason behind that is simply we all need access to primary care, whether it's for us or our children. That's something all Canadians need, and all understand the challenges that exist within the current system. So I think there's a really broad appeal to a large subset of your employees.
Yeah.
Second reason is that we talked a bit about absenteeism and presenteeism and loss of productivity, and I think that's really multiplied when it comes to a small business, especially if a leader is affected. So in a large organization, if you've got a team of 8 financial analysts and one has to miss a half day of work.
Yep.
The impact on a 20,000 person organization, it's going to affect that manager's life day to day, especially if they're working on a critical project. But, a large organization is not going to go under because of the missed work of one financial analyst on a team. But if that 8-person team represents your whole company, and it's you're working on a critical project, and a critical part of that team is missing or is there, but spent all night up in the emergency room with a sick child, only to be told that, hey, it's actually just a flu. She just needs to sleep.
Yeah.
That can have a really dramatic effect on a business's short and long term future.
Oh yeah.
And the final piece of this is really when it comes to implementation and the network effects. So, the mark of a successful virtual care project when we're implementing it with an employer is high utilization. If you're investing in a program, you want people to use it as much as possible. That's how you're going to derive the benefit out of it. So we enable organizations when they come on board with dialogue, with a full implementation playbook, whether it's webinars, email templates, really just this whole package of best practices.
Like emails they can send out to their team to let them know how it works.
Yeah, exactly.
That's great.
The broader challenge when implementing a project like telemedicine is not the actual tech implementation. That's really easy. The broader challenge is communication. It's a new benefit. Virtual care has a broad appeal. For example, the Alberta Medical Association last year ran a study, found that 83% of Albertans would be likely to use virtual care if it were available, but only a third knew anything about virtual care. So if you're introducing a virtual care benefit, it might sound good on paper, but if people don't know what it is, what its limitations are, what are the expectations around it, that can have negative consequences when people try to use it and maybe can't get the access they expect.
Yeah.
So beyond this playbook, really what we found when we're implementing these projects is the projects that have most success have those internal champions. So the word of mouth is really important when it comes to spreading. I mean, even in our own personal lives, we're much more likely to try a product if it gets a personal recommendation from someone we know and trust. So those network effects and that word of mouth is really multiplied when you're in a small organization. So in a large organization, maybe you'll get these different cells. So for that team of 8 financial analysts, if one person uses it, it's more likely that other members on their team are going to use it. For a small business, that's more likely that everyone in your company is going to use it and take advantage of it.
That's a good point, because I think a lot of times companies offer employees things, and I know personally I'll get that email that's really long or something, but if there's just a one-time email and no chat about it ever again, or no follow-up, or it's mentioned in my orientation and we never talk about it again, it's really easy to completely forget about things that are offered to you. So
exactly,
being able to have a communication plan is great.
And there's ongoing communications. I mean, that's part of our communication strategy. But again, the most effective method of communication was if you were going through that situation and you were planning on going to a walk-in clinic and leaving at lunch, and you had a coworker say like, hey, you actually can access, you can have a consultation virtually on your lunch break instead.
Then you can still eat lunch.
Exactly. Yeah, our physicians won't judge you if you're eating while you're consulting.
I want to go back for a sec to the second point that you just mentioned there, which was a little bit about leadership well-being.
Yeah.
So you wouldn't have heard this yet because we don't have it live yet, but we've recorded an episode all about leadership well-being and how it's actually a risk mitigation strategy for companies. So that's going to come out just before this episode does. And that's a good point. We've been talking a lot about employees so far, but for the actual business owner themselves, being able to take a little more control of their own health and being able to check in, because yes, the employees are busy and yes, they need to leave at lunch, but the business owner is often even busier and health issues go just unresolved. And then if that person gets an injury or an illness, it's a huge detriment on the business. Yeah,
exactly. I mean, you feel a lot of personal responsibility to be present and to be working, and just even putting aside like the short-term consequences of maybe missing a half day of work. One of the really exciting things about kind of the future of telemedicine is, where are we in 10 years when more people have access to telemedicine? What are the long-term effects on things like chronic conditions or long-term mental health conditions? Yeah. When more people do have access to being proactive about their health, what kind of impact is that going to have long-term on people's health?
Well, and there's a lot of conditions on the rise, like diabetes is getting huge, and it's supposed to just keep growing over the next couple of years. And I imagine being able to be a little more proactive, maybe people can catch symptoms of these chronic conditions a little earlier.
Exactly.
Yeah. Have you heard of any other uses of this outside of just the business owner and the employees?
Yeah, one of the really interesting things about Dialogue is it's focused on family health. So it not only covers employees, but their spouses and dependent children as well. So that's really critical for a situation like we talked about before, with a young child is sick. But because they're dependent children, they maybe also be covered when they go off to university. Now especially if they're moving away from home, they're in a new city. They're in university, so healthcare access and finding a primary care doctor might not be their first priority. Nope. It can be really helpful to be able to log in, and obviously as a dependent child over the age of 14, they're going to have access to their own account where they can manage their own healthcare independently.
Yeah, and then they'll also have access to the mental health component as well, which I think is quite big when you
absolutely
go off to university and it's a big change.
It is.
I wanted to address some of the common concerns I was seeing online. You can just let me know your thoughts on these. So telemedicine took off quite quickly in the U.S. from kind of what I'm seeing. I mean, that makes a lot of sense. People there don't have the same type of healthcare system we do. But it's been a little bit slower in Canada. Do you have any ideas why that might be?
Yeah, in the U.S., so about 85 to 90% of companies offer some sort of telemedicine solution in the U.S. And the U.S. is an employer-driven healthcare system. So the telemedicine solutions that exist in the U.S. are still a fee-for-service, but because you can find efficiencies, they are cheaper. So that's really the benefit for an employee. Instead of going to a physical walk-in clinic and paying $130 for a consult,
Yeah.
you can get a virtual consult and pay $45 or $75. So it's been kind of an easier model to integrate with in the U.S.
Okay.
In Canada, because there still are costs associated with building a virtual care network. There's costs associated with that, and the expectation in Canada is that primary care access should be free.
Yeah.
And so the whether it's a lack of response from government to integrate virtual healthcare into the public healthcare system. What we've seen is this really has been an employer-driven movement when it comes to telemedicine, where
true.
employers are sponsoring this, like they would an employer benefit, like they would for massage or a chiropractor appointment.
Yeah.
Virtual healthcare has existed in that space, where employees and their families are still accessing it for no cost. But the employer is able to derive enough benefit out of it that they're able to subsidize that cost.
And you're seeing the numbers going up of people that are implementing this?
Absolutely. Yeah, in Canada, we're closer to about 10% of companies that have implemented this, but we've seen a dramatic rise, even just with our platform in the last few years.
What about people who have concerns using this platform because of privacy? I imagine that's one of the biggest
privacy's
concerns.
Absolutely. Privacy is a really critical priority for us because we are dealing with personal health information, and ultimately we are a healthcare company first. So this isn't like a Mark Zuckerberg move fast and break things type of industry. It's really critical that when we roll out a solution like this, we get it right the first time. So to that end, I can only speak for Dialogue, but we take this very seriously, and we have our SOC 2 compliance certificate, which is kind of a standard that ensures data is managed safely, securely, and confidentially, and it's then audited by a third party. So in our case, it was PwC who made sure that we were in compliance of all those rigorous standards. So. Our chief privacy officer is a medical doctor, which helps as well because he not only understands data security, but he understands medical security as well, and the impacts of, for example, not emailing patient information, not sharing patient information, or identifiable patient information between different teams. So there's a lot of rigorous protocols that we've been able to put in place to ensure that patients are safe and confidentially treated on the platform.
Yeah. So for an employee, their employer can't see anything they're submitting?
Absolutely not.
No. Yeah. Okay. With telemedicine, is it more difficult to develop an ongoing relationship with your practitioner? Because you often get to see someone new each time, or can you see the same doctor multiple times?
Yeah, so when we were designing our care delivery model, so how we delivered care to patients, one of the really key things for us was to adhere to what the Canadian Medical Association recommended.
Okay.
Because we are a healthcare company first. So what the Canadian what the CMA recommends is a multidisciplinary continuity of care model when it comes to delivering care, especially virtually. And what that means is not only do we have that multidisciplinary team of physicians and nurses and nurse practitioners and care coordinators, but they all work together as a team because a majority of them are actually employed directly by Dialogue. And that's really critical because it means that a patient has that continuity of care right through their first episode. So this isn't like an Uber for doctors where you're getting a different doctor every time.
Yeah.
You can request the same physician, and you always know that you're working with the same medical team. The simplest way to think about it, it's like a virtual community clinic.
Okay. Yeah, that makes sense. And what about anybody who has concerns about getting an adequate assessment? People who really feel like they need that hands-on treatment. I know you mentioned that a lot of conditions can be treated virtually, about 70% you were saying. But for that person who is maybe just a little anxious that they're not going to get adequate treatment, what would you say?
Yeah, any patient who comes on our platform can be sure that if our practitioners, be it a physician or nurse practitioner, doesn't feel like they can make a safe assessment virtually, they won't. They're going to recommend that the patient go in for a physical examination. So, we are our medical team is cognizant of their limitations virtually.
Yes.
And there's something called Gestalt. I'm probably mispronouncing that. It's a medical term of kind of the feel a doctor gets when they're speaking with a patient.
Oh, okay.
So consulting virtually, you can replicate a lot of that because you're seeing how the patient is reacting and what their physical emotions are. But it's not a complete replacement for physical touch in some circumstances. So again, if a practitioner doesn't feel like they can make a safe assessment or safe treatment, then they will not.
So let's talk about implementation in a business. So if a business is interested, how quick is this to implement? Is it difficult to implement? What does that process look like?
The actual implementation is very simple. It's typically it depends if your client is working, if this client is working through Olympia Benefits or not. But if they're working through Olympia Benefits, it's as simple as speaking to Olympia Benefits and having it added to your plan. If it's a business that's not aligned with Olympia Benefits yet, you would work directly with us. You'll have an agreement directly with us, and it's just a simple CSV upload into a portal. It's a really simple process.
Of your team?
Of your team,
Yeah,
of your patient's or employee's first name, last name, date of birth, and email address.
That's great.
That's really all the information we need, and each employee has the ability to add their own family members. That's not something that you, as an employer, have to manage.
Yeah.
So once that's done, again, the challenge really comes down to communication, and that's where you'll be connected with a customer success manager who works on our team, who's going to be able to provide you that full implementation and onboarding playbook to ensure that you have the resources necessary to roll it out for your team.
That's nice. You don't have to worry about figuring all that out. I know you mentioned you have the communication plan. Do you have any other tips you would suggest to make sure that a business owner is getting the most out of their telemedicine account?
Yeah, I think the important thing is just organizational buy-in of wellness in general. Understanding that an employee who feels well and is proactive about their health is going to be a more productive employee. So just getting that general buy-in and building the culture around those kind of ideas, that's going to go a long way to being able to encourage this kind of use.
Yeah.
And really being able to connect it as a broader strategy.
Yeah, no, that's a good point.
Instead of just adding this as a benefit that sits over here, this connects to the wellness strategy in this way. This connects to our benefit strategy in this way. Enabling the where it's not a siloed benefit. It really is part of a broader cultural piece of a company.
Yeah. So right now, this is my last question for you. So right now in there, we can do you can talk about your physical health, mental health. Where do you see this going? Are there going to be more elements of health added, more features added? What's the future for telemedicine?
That's a big question. Yeah.
What's your business strategy?
Yeah. So I mean, the big piece of the future of telemedicine is the scope of practice is only going to get bigger as technology improves. So, for example, can we get to a place where an Apple Watch can take a heart rate measure that would be medically acceptable? For us as a company, it means diving into different areas of health where telemedicine can be applied. Be it especially mental health. We've rolled out a new mental health platform. Where can we see improvements in technology? I mean, we mentioned our triage process. The results of that already we've taken. When we started out, we had kind of a nurse-only triage where you'd be connected with a nurse. She would go through this triage process, and what they found was, it took about 20 minutes to safely and in a standardized way triage a patient.
Yeah.
We've reduced that time by 85%.
Oh, yeah. When I did that, it was like a couple minutes maybe. Yeah.
Yeah, and we're working with one of the Montreal super hospitals right now on a pilot program to actually integrate our technology with their triage process. It's not just how do we take an emergency room and have it exist virtually.
Yeah.
It's really about how can we leverage technology and digital health to improve the processes. So triage and follow-ups are two of them. Incorporating electronic medical records is another. Can we get into the business of predictive health? So if we know on a patient's medical history, they have a history of respiratory diseases, and we know that tomorrow it's going to be a muggy day outside. Can we send notifications to that patient, letting them know that they're at higher risk and they should prepare in this way?
Yeah.
And what are the effects on long-term chronic conditions, be it mental health or physical health? And the final, just the big unknown is what part is government going to play in this? Because right now this is an employer-driven movement, but the government will be involved in some capacity at some point. Right now, I mean, one of the most impactful changes they could make today would be through licensing. So the CMA just released a survey that said that 91% of physicians would support the implementation of national licensure. So that would mean, a patient or a practitioner who's licensed to practice in Alberta could be licensed to practice right across the country.
Oh,
which not only would have benefits for telemedicine, but it would have benefits for the whole medical the community. So whether their licensing changes, whether it's a government investment in telemedicine, that's the great unknown here in Canada. But right now we found tremendous success within the employer market, and employers have really stepped up, taking advantage of being able to provide better support for their employees' health.
Yeah. So ultimately, just improving Canadian health.
That's it. Yeah. Lowering the barriers of access to care. That's our mission at Dialogue, and so far we've seen tremendous results from being able to enable employees to get better access to healthcare.
Awesome. Thank you so much for tuning into this episode of the Small Business Mastermind, and a special thank you to our guest, Steve Chamberlain. If you enjoyed this episode, please be sure to subscribe to this podcast. This will make sure you're notified when new episodes are posted. For our Apple Podcast listeners, I'd really appreciate if you took a moment to rate and review this podcast. It will not only help me see which topics and episodes you're loving, but it will also help other people find this podcast as well. We have new episodes on the way, so please stay tuned, and I will talk to you again very soon.